adjustment right there. That's it.
All
Other
right.
side. There's a lot more, but
Okay.
but that was the first of many. Okay. It's different in that when a chiropractor does it, we know where to push.
Mm-hmm.
Is there anything that you want me to specifically address that you're like, I mean, it just kind of said just general wellness care.
No, and I mean, I think the
Okay.
biggest thing is that, like, I may be functioning at like a high enough level that I don't notice something is like a little bit off.
Okay.
And like if you are like, this obviously, does this cause you pain? I have no idea. And like, I really have like no complaints, but if you find something
That's
that is
okay.
like,
It's called wellness care.
Yeah.
When we write our notes, it's like
Yeah.
patient presented for wellness care. Yay!
yeah. So I mean, I feel pretty good now, but like again, if I can feel
Okay.
better,
Drink a lot of water afterwards. Okay. As you well know, can't predict how much somebody will bruise. If I have somebody in between, they don't bruise too much.
yeah.
But if I have somebody that's working out a lot, they're gonna bruise. If I have somebody that's really stationary, they're
Mhm.
gonna bruise because there's no circulation.
Yeah.
So there's the two extremes tend to
Okay.
bruise. Like I said, you only bruise really bad the first time. Any other questions for me?
No.
No. Okay, then I just do, because I'm not doing surgery,
Yeah.
I just do a posture check.
Yeah, absolutely.
If you don't have any neurological symptoms or anything,
None. Like literally.
then
no.
I'm just going to get a baseline for
Okay.
you then. It really is just this I'm using
Okay.
and my eyeballs to assess you. So you have a slight left high shoulder and a right pelvic translation. And if you look down at your feet, your right foot is flared slightly.
Mhm.
Okay, what does that tell me? Anterior pelvic tilt. Usually just the right hand side compared to the left.
Okay.
And come on back. Yeah, and I see it. And come on back. That's good. Good. One more time for me.
Okay.
Check another region. Just slight, very slight from the base of the scapula superior. You're just slightly rounded forward. And it's only there.
Okay.
I'm surprised it's not in the lower back.
Yeah.
It's just here. And it's very slight. And that's all I see there. Come on and have a seat there and face that way. This is where I expect some inflammation. You, me, everyone.
Mm-hmm.
Okay, I'm just feeling.
Okay.
Like, how much does it want to move? How pliable is it? Is he flinching? Is he okay with this? I'm pretty heavy-handed. I'm not real.
It feels good.
And here's that little bit of, this is a compensation in the occiput. You just want to kind of push those fibers back down. That's what I'm going to be doing. As you look down, they somewhat lift off of the skull. Okay?
Okay.
And then I just kind of bring you back and push little Sharpie fibers and try to like get those to reattach. And they do. I just wish more research was done on it.
Mm-hmm.
Like I have people tear off like pieces of fascia and they're
Oh my
in
God.
extreme pain.
Oh.
And they go and get
Can
ultrasounds,
only
can't
imagine.
find anything.
Yeah.
And I'm like, I just gotta squeeze it back down, you
Mhm.
know? It's so archaic.
Yeah.
It's like literally, I just gotta push it back down and hope it
Mhm.
attaches. Because it's not like an avulsion where you'd have to have surgery.
Yeah.
There isn't anything that they're gonna find.
Yeah.
But that's why people get some pain or discomfort is
Yeah.
because that there's this little tearing.
Yep.
And all I'm doing is just sitting there and squeezing it and pushing it back down. They reattach. It's amazing.
The body's incredible.
I will say chiropractors have we have a lot of training on the tissue and
Mhm.
how to work with it. And if you go to another chiropractor and they're not doing it, you just gotta complain more.
Mhm.
Like, why aren't you doing this? It kind of goes down 1, 2, 3. Well, then it stops here. And then we got the little bit of compensation over here, okay? Not too bad though.
Okay.
Nothing out of the, it's very common. I'm going to test this out just right here, see how pliable that is. Ooh, it's a little crunchy there.
Mm-hmm.
And as you know, they're just repetitive. If you do this to your tissue all the time, it
Mhm.
puts in some kind of glue. We just try to tack that down and smooth that out. Right there. Does that feel okay?
Mm-hmm.
Okay?
Mm-hmm.
All right.
Yeah. sometimes when I bench press, I'll have like a clicking in my shoulder. Yeah.
Yes. It just gets loose.
And it's only on the left. It doesn't necessarily hurt.
That's fine.
Yeah.
I mean, when it hurts, that's when we worry because we're like, ooh, look, see that one too. This is T1, rib up here. And that just every time you lift, T1 rises up. Same thing with the clavicle. You know, you do these, T1 it just goes up. So what do? We go the other way.
Yeah.
Okay, but you don't want to separate it from the articulation with the spine. So that's why I'm coming in here and kind of pushing at an angle.
Makes sense.
You're just kind of pushing that joint back down. This is where chiropractors live all day. Spine. Make the noise. Make the noise. Why would it make the noise?
It's like such positive, like instantaneous feedback.
Yeah. Yes, it's gratifying.
It's very gratifying. It's
like, I know I moved it.
Yeah.
But it kind of like doesn't do anything. You're like, did it go? Did it not? I mean, maybe. I think so.
It's like pimple popping videos online. It's like, you know that it like instantaneously happened. You're like, look at.
Well, yeah, it's like it's kind of gratifying, especially to the physician and the person that's the patient. It's like, oh, she did it.
Something happened. I heard it.
So there is quite a little, I'd say, moderate amount of like density of muscle tissue that, in order to get down into that joint, the flexibility of the joint is totally separate and independent from the muscle.
Okay.
It's just. Like people always ask, I think one of the big questions is it hard to adjust people that are obese? It's not.
Yeah.
It's actually really easy. I'm not finding that the mass has anything to do with the joint mobility at all. So I'm just going to go right at the top of the neck, okay? First adjustment right there. That's it.
All
Other
right.
side. There's a lot more, but but that was the first of many, okay? Oh, very flexible over here. Might not have anything over here. Right here? A little bit. That's all you need. Of course, you're going to hear my body pop and crack. Like you were saying, loose shoulder. Yeah, me too. Punching this. Do you feel how much looser that is? So as soon as you give an impulse, just lets go. The atlas and axis are 50% of your range of motion in the cervical spine. Looking right, left. Occiput and C1 are your yes. Okay, so if I can unlock those for you, you gain quite a bit back. Yeah, that feels much better now. That's what I'm saying.
Does it last a long time?
Yeah.
Oh, good.
So my point is like you're not moving the bone. If you would have to break the bone in order to do that. What we do is just kind of mobilization, whatever can move. You know, these guys down here, you notice I didn't crack or I didn't adjust these, right? I was way up here. There's no discs up here, first of all. Can't herniate anything. These guys, you can herniate these guys. But there's no disc up here. What do we have to worry about up there? Vertebral artery. So as long as the patient's healthy enough to receive an adjustment like that, go for it.
Yeah.
This isn't, like it isn't surgery.
Yeah.
It's just mobilization. It should just feel good. So we're going to do the toes. Because why not? Get circulation in there, blood moving to regions that the body doesn't really necessarily pay attention to as much. Sometimes the body doesn't send in, what is it called? You would know. Cytokines or whatever, to an area unless there's an injury.
Yeah.
So you kind of fake an injury to the body. It's not really an injury.
Yeah.
And the body kind of goes, oh, wait, maybe I need to go pay attention to that.
Uh-huh.
Like, we're going to do this right here, okay? Just kind of stretch the joint capsule a little bit. Not enough to tear it,
Yeah.
but just kind of brings attention and awareness to the body. Hey, you need to go fix that.
Uh-huh.
I'm just mobilizing. It also tells me where you place your weight. Okay, you definitely, that feels better now. Place way more weight on this side. Good, excellent. Okay, do you mind having your shirt off?
Of course not.
Shirt off on your stomach. Careful of this piece here, this is wood, and this is wood up here. How did the neck feel?
Good.
Okay. First adjustment, I mean, what did you think?
That pressure felt so good, yeah. It was much less like climactic.
Sorry, it wasn't as eventful as you thought it was going to be. Can you imagine us breaking anything?
Yeah, no.
With that amount of force, we can't.
No.
It just, I don't even know how to do that.
Yeah.
Actually, Taekwondo, I could think about it. Probably come up with, but not that way. There's just no way. You're just taking knuckles and pushing.
Yeah.
Knuckles, like your fingers. You know, that's
Uh-huh.
all it is. Knowing where those knuckles are, though, that's where the training comes in. So take a deep breath in, and then let all the air out so I can approximate the joint. Oh, I can try. Good. It's a little tight. Okay. Good. See how that just doesn't want to go as easily. So we gotta work on it. All right.
Yeah, I can just feel like a little like tautness in there.
I'm not gonna knock the wind out of you without warming it up.
Hmm.
You know, I ain't gonna
Eh.
do that because I don't want to sprain it. I'll sprain it if
Yeah.
I go too hard. You do have a lateral curvature over here to the left. Okay, I'm gonna bounce.
Okay.
Just letting you know. Go a little harder if I can. Keep breathing for me. Excellent. Okay.
I can almost feel like a wave going down my back.
Yes. Okay. Just, are you okay?
Yeah.
Okay. That's your own nervous system. Well, it's what we believe it is.
Yeah.
It would have to be, but it's more of the central nervous system. Again, like with the skull, you're moving around cerebral spinal fluid. It has to be influenced by all the
Yeah.
pressure. You know, it's a
Uh-huh.
pump, right?
Yep.
So you're trying to pump that fluid through the skull, through the spine. You know, those parts are hard. You know, we can floss our teeth. We can't really floss our spine so
Yeah.
well. We can do yoga and we can try to stretch. But what happens is we tend to hit the muscle and the fascia before we ever get down into the spine. So it's nice to have some direct pressure on it. Your body does the flossing. Your body does all the cleaning. I'm just saying, hey,
Yeah.
how about right here?
Uh-huh.
Again, like I said before, it's just kind of given like a little bit of an impulse to wake up the body to respond, but not enough of one to cause an injury. But what happens is when I break down tissue, there's always soreness the next day. Well, yeah, what they find is they just find myoglobin. I'm like, how do you know the difference between the red blood cells? And they're like, oh, we know.
Yeah.
I'm like, okay. All I have are case studies. It's all most chiropractors have to go on.
Yeah.
They're just like, well, that worked, that didn't.
Uh-huh.
That leveled out the spine, that didn't. Here we go. This part is, where the QL hooks on right here. Okay, and the bottom of it is here, the iliac crest. Oh, you've probably seen the inside. I bet there's variables.
Uh-huh.
But I try to loosen those attachments. Okay, I try to kind of mobilize those. This one here, especially. This one seems to be the secret of the low back. The low back is always so mobile. Everybody likes to crack that one. I don't. It makes a nice sound though.
Yeah.
But it's
Yeah. Uh-huh.
it's the most likely segment to herniate, right? Here and here.
Yep.
I don't touch those.
Yeah.
I ain't gonna go slip somebody's disc. I don't want to. They're gonna do that all on their own.
Exactly.
I don't need to go be pounding on that.
Uh-huh.
Leave that alone. I work up here. I work above it and below. So work right here at the base. You do have some petechiae already coming out.
Okay.
Etc. What do we have here? Get that guy down. There we go.
It's cool. I can literally feel a ripple down my back.
Yeah, I'm trying to squeeze. It's just fluid edema, like a swollen ankle, but it's in your back.
Yeah.
But it's not enough edema to cause you pain.
Yeah. Can most people feel this movement?
Yes.
The fluid? Yeah.
They feel. You're fine. You're fine.
Oh no, I'm just.
Oh, I
It's
feel.
just like a cool sensation.
Well,
again,
you're very,
something's moving. I don't know.
Right. And that's what I told you. You're gonna feel like tomorrow, okay, she
Yeah.
pushed around some fluid. And here's the joint. Okay, that's the joint capsule right there. And I don't think, how far down is the sciatic nerve?
It can't be that far either.
Because I tell people all the time, they're like, oh, well.
Even when I have loss for a lumbar epidural, I mean, it can't be that far in because honestly.
Oh yeah, you go right here.
And it's I'll have loss in the epidural space at 5 centimeters. So I mean, if there's 2.54 centimeters in an inch, that's only 2 inches.
Yeah, because here's the SI joint, right?
Uh-huh.
Big bulky joint. I go in here and I try to move the bulky ones. The little guys move way before the big ones.
Mhm.
That's just physics of the pelvis gets compressed when you stand or when you sit, and that pressure tends to lock up these joints and do funny things to them. They're mammoth compared to these little guys. So they're much harder to move for my job. Okay. So I work on these and I try to loosen up the fascia a little bit so that it just kind of glides. They say, I had a professor say you couldn't move this. I'm like, it moves. I feel it moving. Don't lie to me.
Yeah.
It might only be 10 degrees, but it moved.
Yeah.
Here we go again. We take an x-ray before and after and you're like, well, I don't know where it went because it looks like it's in the same spot. So we're just mobilizing. We're taking it through its natural range of motion very quickly with the adjustment. And sometimes they get stuck. The SI joint frequently just, it gets locked up and then guess what moves instead? These guys. That's why they herniate.
I like that description. Is that you're taking it through its normal range of motion just very quickly.
It's just very quickly. We go in through that joint range of motion. Joint play, as we call it. That's a chiropractic term. There you go. So again, this sciatic nerve would be about here.
Okay.
Okay, piriformis muscle.
Uh-huh.
Cluneal nerves, lateral femoral cutaneous nerves over here, runs down the side of your leg. I just make sure these are all cleaned out. And there's nothing catching it, because any kind of pressure is going to cause it to fire if it can't glide with the muscle. way they were made. It just likes to lift up, so it feels good to have that pushed back down. You doing okay?
Yeah. Great.
We call it turning the power back on. There's we have all kinds of sayings. There you go. Woo. If I can find it and stay on it where it's supposed to go, there it goes. This is like T2. Okay. That feels pretty good.
Okay.
Now I'm going to do the scraping. Are you okay with the bruising?
Yep.
I think I asked that. I can't remember.
Scrape away.
Scrape away. Through that fascia.
Well, because some people's responses, I seem like, to this are, like, some people's are pretty profound.
It's about what I thought it would be.
Okay.
About medium level.
Okay.
Nothing terrible. Nothing crazy. But it's from working out. Normal. At least from my point of view.
Yeah.
You won't need that. The ambulance. None of that. We always say wrong kind of doctor. There you go. It's in your ribs, So
Yeah.
for example, okay, this rib, well, that might be the false ribs down there. Not too much here, okay? But now feel this one.
Oh, yeah.
Feel all
Whoa.
that?
Yeah.
That's where you turn red.
Wow.
So
That was very different.
Yeah, there's some gunk in there.
Yeah.
Here's what this one's smaller. Oh, right there, I didn't pull.
Yeah,
I didn't get all that. And you try to pull that up to the surface and let the skin deal with it. It feels like sludge to me. I'm shifting it. I'm like,
Uh-huh.
And then I feel it and I go, okay, let's pull it out a little more. Let your bowel and your kidneys deal with it. There's little organisms that come in there and eat it, or whatever your body cells that come in there and eat it up, and you pee or poop it out. And that takes about 7 days.
Okay.
But I'm not damaging the skin, so
Uh-huh.
it's just coming up to the surface, and it takes time, so a lot of chiropractors won't do it. You imagine billing for this?
Yeah.
The insurance company's like, was that really necessary?
Yeah.
This is all just ribs. Ribs. Here. The articulations themselves don't have as much coming to the surface. Let me see what this is. Let me see.
I wonder with that little curvature too, if like the other side.
Yeah.
'Cause,
Okay.
like,
So
like with
this
the scar
curvature.
tissue on the right,
Right.
is it going to be more then?
You never know.
Yeah.
So what I noticed with, I'll usually find a pocket right
Yeah.
around that scar because it's small. The edema just isn't following it. Okay. And it has to be the body mechanics that determines whether it does or does not.
Uh-huh.
We're just tubes. We're just a bunch of tubes. No, this rib, it's way more petechiae over here. Way
Oh,
more.
really?
Yeah, about twice.
Huh.
I mean, I don't know. I just haven't finished with it yet, but I can just feel it. There's just way less inflammation. Can you tell, like, if I go down this rib? See how that's all healthy?
Yeah, I didn't really feel it as much on the...
It's healthy, firm, compact tissue. Okay. There's a little bit right here of granulation here. Okay, and then I go, okay, maybe I can pull something out of there. It's like a little web. But over here, now I gotta stop because I will make you bleed. It's all puffed out. So this whole rib cage is flared here.
Yeah.
Okay. Into the lat here. And so sure. It feels better now. Okay.
Yeah. It's so cool that you can like feel those little discrepancies with your finger.
That's what I told you at the beginning. This is the only tool I got.
Yeah.
My That's it.
Isn't that cool though? I mean, I think that's awesome.
I can do it with my eyes closed. And I go through and I check, is it gliding, is it moving?
Yeah.
If I really wanted to, I'd say, okay, like people that come in with shoulder problems, I have them test it out. Move your arm over your head. Take it behind. Do we have it all? And yeah, they are sore for a few days afterwards. And I'm like, just be careful. I've broken all of it down. You will feel like you're disconnected from your body for a few days. Like, whoop, the neck works weird now. It's just you happen to recruit different muscles that you haven't recruited before.
Yeah.
Or that don't, what is it, we're talking on the micro scale. They see this all the time.
Yeah.
My little, they're just like on Instagram. No, I will run it along the spinous processes, and what I notice is that whatever one turns red, those are the irritated ones. It's like the fold in your neck, right?
Yeah.
You know, the fold in the neck back here is because that's where all the movement is going on.
Yeah.
You know, that usually tends to be the most sore ones.
Uh-huh.
I don't adjust those.
Yeah.
I go up here, or I go down here. I'm trying, you know, if I'm going to put this much energy into it, why would I want to put energy into a spot that you already do yourself?
Yeah.
Why would I want to do it? No, I need everybody to move the same. Do they make you take, they have to. In med school, they take you physics and...
Oh, yeah.
I
There's a lot of prerequisites, too, so like it's like theoretically already done. Which spinous process is getting irritated?
So we got to count them. I haven't done the upper ones.
Okay.
So we got T1, 2, 3, 4, 5, 6, 7, 8, 9, and 10.
They're all mad?
And the rest are fine.
Oh, wow.
Just here.
Yeah.
It's just congested. It's not bad. They're probably the ones where it's stagnant.
Okay.
Where there's no motion. It's kind of, there's two different, like I said before, there's two different reasons why I get it. When it's not moving or it's moving too much. The ones in the middle, they don't tend to build up. They're not irritated and there's circulation, so I don't tend to get the buildup. But it's the ones that are doing on the two extremes. Too much or too little. Sometimes, oftentimes the ones that do a lot of motion, there nothing comes out.
Yeah.
Now for this one, I will have you arm up over your head. I just kind of get underneath that scapula there. Good. And then down, that's all I had to do there. Just kind of brings it down. Try to follow the plane of the muscle. There's layers though. They go all different kinds of ways. So you try to find out which one it is that's giving you the trouble. You go in that direction. So for these guys, what I'll do is I'll probably have you sit up.
Okay.
So, I don't know if we take a picture of them now. I will tell you, this is a little bit more prominent over here in the upper region, but you have it here too.
Okay.
And this is all coming out.
Something happened.
I don't want to touch the camera, but like if you zoom in,
Yeah.
you can see that side. Go ahead and move it that way. You can do it. Go ahead and just move it around. You can take
That's
it.
nuts.
This side wasn't as bad down here,
Yeah.
but up here, and
Oh,
this
yeah.
side is where you're feeling all that kind of,
Yeah.
geez, for lack of a better word, pus.
Yeah.
And then this kind of really came out dark, but here nothing,
And then.
and up there.
Yeah.
And that's what I'm working on right now.
Okay.
These were the ones that were inflamed.
Yeah.
Only a itty bitty one
That's
there,
so
but
cool.
now see this fold in the neck?
Mm-hmm.
That's where you naturally flex when you go backwards.
Mm-hmm.
And that segment tends to be always the one that degenerates faster.
Okay.
So I try to go and move the ones above and below it.
Mm-hmm.
Because why is only this one moving?
Yeah.
Okay. The other ones need some help. How are you feeling? Sore?
Good. No.
Feels good then?
Yeah.
Like just take your arms up and around. Like I said, that's about all I can mostly do.
Mm-hmm.
There's just like a component of warmth on my back, like.
Well, yeah.
Yeah. Uh-huh.
But yeah, that should give you, as that heals and dissolves, you will be more pliable.
Okay.
Okay.
Mm-hmm. I feel good.
Okay, on your side facing me. Yes, there you go. Perfect. Other side.
Definitely hot.
Oh yeah. Perfect.
Yep.
I want to see if it feel this bottom piece right here.
Okay.
If it goes, it goes. Nope, that's all goes. Okay. Come on and sit up and face this way. This one. Good. Lean away. I don't do anything crazy. I'll let you guys do that.
I can definitely feel like the opening of the joint capsules, like when you.
Yeah, you're just.
It's yeah.
I just kind of shuck them.
Uh-huh.
I don't go too
Like a
far.
clam.
I don't see that one's a little loose.
Mm-hmm.
I don't need to go too hard on that one. Okay.
Yeah. My thumb can actually go backwards.
I believe it. It's like
Yeah.
like these are a little tighter, but this is like
You
ooh.
can like literally like go the other direction. Yeah.
So I don't need to be.
That's like a party trick. Yeah. Don't take that thing right off.
It's all by feel.
Yeah.
I kind of test it. Okay, let's go.
Yeah.
You know, I'm feeling here. So it's just the skill of the person doing it. Lean away. There's a little stuck. There we go. Excellent. That's as far as it goes. Very good. Let me see if I did any. Yes. Okay. Much better. I wish we had a picture from before, but we have your posture, I think. Stand
Mhm.
here just so we get this, so you can see this. You know what I mean in your video. Okay, here's you now.
Mhm.
Want to take a picture? Let's take a picture. Because it really is dramatic.
Well, that's in the thing I said, like maintenance and then like posture.
Posture.
Like I can literally, after like a long day or something, like everybody
That-
is like
that-
a little bit like this.
Of course.
Like I'm always like cognizant of like trying to like chest up, but like this is just like no.
That's
natural.
your normal.
Yeah.
That is after me squashing you for about an hour.
Mm-hmm.
So I'm going to take back and I'm going to stretch the ALL.
Okay.
And that usually is enough to get that scapula to drop down.
Okay.
And then arms out to the side for me and breathe. If it's too hard to breathe, we can lower the arms down. If the arms go numb, also we can bring them down. I wish the surgeons,
My
you
body
have
is like
to know it. You okay?
my body is like naturally adjusting. So like
Okay.
when you're like when we look at this video,
Well,
30 seconds ago my arms were in the air and they've just sort of
well,
melted slowly towards the ground.
you should feel, you did really well for not ever having done this at all.
Okay.
Okay, very well. Most people are, oh, what's that? I think it's because you already know what it is.
Yeah. I
You
kind of
just have an idea of what
I
we're
also
doing.
like signed up for this.